welcome back to Fresh Perspectives in Social Work, a podcast produced by BerryDunn and the State Government Practice Group. And I'm Annie Messinger, manager within the State Government Practice Group. And I'd like to welcome back Laura Hunt from the State of West Virginia, Department of Human Services, Director of the Office of Quality Assurance for Children's Programs. Welcome back, Laura. Thank you again for joining us.
Hey, Annie.
Hey. So where we left off was talking about CQI and lessons learned from the process in establishing and implementing processes. So let's talk a little bit about the process and feedback, especially. When thinking about critical connections and timing, what were or are the necessary systems integration and outcomes to the child level journey in your experience?
So a lot of that starts with going back to some of the thought-provoking questions that we talked about in the last podcast. I think sometimes, especially folks who aren't used to working with data, they can sometimes get overwhelmed because they don't know exactly what to ask in the technical terms or in the database terms in order to pick out what is the right field and the numerator and denominator and all of those things. But I don't think that you have to start that way. I think that you can start out by asking questions of, just as simply as what do we want for kids and families? And, for us, first things first, we do have our Kids Thrive collaborative that we do statewide, and it's what a lot of this work is centered on. We want to make sure that kids and families can thrive in their home and communities when it's possible and safe to do so. So it starts to beg the question of one of our biggest outcomes measures is looking at, are we able to divert children from residential placements if they're able to be served in a home and community environment? So looking around that, we started to look further at assessing kids' needs. We've done that through independent evaluations and assessments to make that more objective, and just really looking for further opportunities to understand that. So one of our simplest outcomes that we look at is our residential mental health treatment placements, and we look at that both in and out of state. We also do some comparisons there with state and national needs for mental health because that can influence things. But we compare a lot of those with utilization metrics to see, is our utilization of home and community-based services going up, and are more restrictive placements going down? Similarly, we look at probation and Bureau for Juvenile Services rates. Those are all some of the systems level outcomes we look at. But I think it's always important to look at the child level journey and the different systems that they interacted with before they had those outcomes. Mm-hmm. And, it's been a real learning experience for us. In West Virginia, for many of the items that we look at, I would consider us still in the prototyping stage. And, I think data review can always be flexible. I think just like we're trying to implement a continuous quality improvement framework for our programs, we can also do that for our data analysis. And as we understand the work that we're looking at more and more, we can be flexible with our indicators to adjust them if we realize that we want to answer a different question. Mm-hmm. Of course, if we want to look at something over time, we want to try to stabilize that indicator so that we're comparing the same thing over time. But we do have the flexibility to ask additional questions or to understand things at a different level to see what is influencing our outcomes. So I think that's really important as well. And it also helps us to understand, I know we talked a lot on the previous call about collaboration with whether that be internal partners at various levels, as well as stakeholders. Like, for instance, with us, we work closely with Department of Education, Homeland Security, probation and the courts, to make sure that we all have the information that we need, not only from the data side as far as continuous quality improvement, but also the perspectives on the individual processes that go on and can influence that data. I just can't reiterate enough the importance of data in context, and it really takes all areas of expertise to understand and be able to drive the work and make sure that what you're looking at is representative of the processes, and you're taking into account the processes while also being able to think about how you can make strategic change. Like if a number doesn't look the way we want it to be, like for instance, if we're thinking about residential census, what are the key factors that influence that? So, as an example for us, that we could look at admissions, we could look at discharges, we could look at length of stay as some key additional indicators that influence that overall outcome. And we can start to have conversations about, okay, what influences admissions? How can we make sure that kids are screened early on, that they're referred to home and community-based services, they're given the supports that they need in order to hopefully prevent that out-of-home placement whenever it's possible and safe to do so. And then when we look at discharges, do kids have adequate discharge plans in place? Do they have a system and structure and supports for whenever they get out of that placement to ensure that readmission doesn't happen? And making sure that the key folks, whether that be the court system, the providers, social services, families, have the tools, resources, and information that they need in order to influence those things. So you can see just based off of those couple examples that it can be a pretty wide spectrum. And I didn't even mention like Department of Education and their influence on some of these things, and understanding that there may be additional community-based resources, or a common barrier that we see is folks worried about credit transfers as far as schools, and not making that a barrier to allowing a child to go back home. And so working through some of those things have all sprouted from being able to have conversations and understanding the details as to why children are in residential placements, and making sure that that's an appropriate place for them to be. Because again, ideally, we want folks to be able to be in their least restrictive setting that's safe for them and their family.
Right. And then when we talk about those external audiences or those partners who look at the data to help inform practice, I think we talked about, it needs to be explained well enough for the audience to know what action to take as a result of the data, right? Yes. So court systems, Department of Ed, other key stakeholders in a child's case or life, making sure that buy-in is there, right? And we'll talk about buy-in in just a couple minutes, but I know we talked about that audience and explaining very well what's going on with the data.
Yes. Absolutely.
And then, so can we talk a little bit about that qualitative companion evaluation?
Yeah. So that's just, I would describe it as another piece of the puzzle to understanding your full system and what's working well and what could use some additional strategic planning or change. And so, it's really important for the qualitative companion evaluation that you have those independent evaluators so that they can take that non-biased approach as far as doing sampling of your system and getting feedback and perspectives from members of the community, whether that be stakeholders, providers, caregivers, etc., and just really gives you that opportunity to get that open feedback, identify gaps, potentially misunderstandings. I think that was a common thing that we found in our evaluations is, often there will be capacity for services or availability of services, and word of mouth may get around, or a misunderstanding about who's eligible for the service it can often lead to misunderstanding, and so people will stop referring for a service. For example, I know when we first started our assessment pathway, there was a misunderstanding as far as who could get the service, and I remember hearing feedback from the court community that they thought you had to be involved in social services in order to get home and community-based services for mental health. And so a lot of times this type of data allows you to do a sort of mythbusters type approach, so that you can understand that this is the perspective out there, and it gives you opportunity to do education or to continue to address gaps that may need to be addressed, even if they're known at the program level. So it kind of goes both ways as far as identifying needs overall, as well as educational and perspective concerns that may need to be addressed in order to help people be able to navigate and get the services that they need.
That's great. That's great. Well, now we've come to the point in time where we talk about achieving buy-in. And some of those tips about quality improvement implementation. So, Laura, when you're just getting started or having difficulty achieving buy-in from stakeholders, where do you start?
Yeah, certainly. So I'm not going to sugarcoat it for anybody. It's not always easy when you're first starting out. Kind of going back to some comments I made in our first podcast. When you first start out, or if folks aren't used to looking at data, sometimes they can get overwhelmed. They can be afraid to ask questions, or they can say, I often hear the phrase, "I'm not a data person, so this isn't for me." But CQI, continuous quality improvements for everyone, and I think it's just a matter of helping people find their why. I think that comes first and foremost as the best way to approach this. I'll be honest that I have heard in the past that folks that work with statistics are just worried about the numbers, and I know that can be pretty blanket statement. But it's I would say for most of us, it's not true. There are people behind the numbers, and so that's why it's so important to look at them. And so that's why it's important for all of us to find our why. Why are we doing this work? What's important to us? And I think when you establish that why, that for example, I really want to make sure that that kids can stay in their homes. And be able to go to school and be able to find ways to cope with their mental health needs, then all that can go back to data to understand what's working and what's not. And so if you focus on the why, we can find the data to answer the questions that help influence your why. So I think another way to help with that, though, is to try to help the folks in your collaborative group stay encouraged, is to try to remember to celebrate your wins and your trends and progress. Anytime that you can trend out progress, that's great. Even if it's progress related to newly implemented processes. So sometimes we will start out our reviews with just maybe it's a bulleted list of our wins, because, maybe if we're not seeing the data change yet, because sometimes it can take a while for the data to change and things to be influenced. But we can celebrate the fact that we did implement this policy, and, we're going to be able to look at the data either in our next review or at this review and see where we are. And again, even if the data that we're reviewing isn't where we want it to be, it should be celebrated that we even have it in front of us so that we can look at it and we can make the change. So, again, it's not about good or bad results, especially when you're starting. It's more about the opportunity to be able to have the change and to look at it and celebrate that you all are doing the work and you're trying to make the change and the next steps. And that continuous quality improvement approach allows you to swerve if you need to, or to adjust accordingly. So I think that's an important perspective to keep. And again, having that space to where people can ask the questions and learn from each other. And often that can start with keeping things pretty simple, starting out with basic demographics. What does our population look like? Who are we serving? How old are they? What gender do they identify as, etc. And that just gives us a better understanding of who we're serving. Like in West Virginia, for example, one of the first things that we realized by just looking at that level of information is that a lot of our home and community-based services, especially for starting out, we're serving younger kids, and our kids in residential mental health treatment facilities were older. And we were also seeing some barriers with the older kids related to foster placement, and so we did identify some disproportions as far as age, and we're able to expand transitional living based on some of that feedback, and understand that sometimes it may not be a need for treatment; it may be other needs that are creating barriers. So those early conversations were able to help us there in West Virginia, for example. But you can always continue to expand on that. So, once you understand more about, like for instance, we are seeing kids that are older in residential facilities. Well, why is that? And that can help expand the process of learning, as well as open questions and engagement, to where you can, in future review sessions, you could start to explore, okay, do the older kids have a higher acuity of need? Is it because placements or home settings aren't available for their kids? Is it something else that could be influencing that? And, some of that starts with a conversation of just anecdotally, what do you all think it could be? And then working towards that with the data to confirm or find the truth about what is happening, so that you can address it strategically and soundly by knowing, okay, this was our hypothesis, and if that is the case, once we look at the data, then we can address that. If it's not, then we'll know where to go next. I call it kind of following that breadcrumb trail of where to go next, and being really flexible with what you look at in the data to be able to answer the questions that come up with the group.
And it gives them a sense of confidence or ownership if you help them or guide them or let them start to understand the data, right? Toward those of the indicators being reviewed, and then diving in deeper as you go into, what makes the most sense for change.
Absolutely. Yes. And so, to give an example, and if it helps encourage anyone, when we first started our processes, we get some pretty awkward silences. And we just kind of had to keep pressing and asking questions in a way that resonated with where people are. Well, we could change it around to, like, even if folks may not understand the visual that we're explaining. Some people are pretty bold, and they'll just say, I have no clue what you're trying to show me, which I appreciate, because if folks don't understand it, then what's the point? So that's why it's important to have those conversations. But it also, for the quieter folks, it's good. We tried something recently to where we started asking polls, and that really opened up the conversation too, to where we started with, what are your expectations for this? How many kids would you expect to have this service, based on given factors? And so then we can start to open up the question of, okay, why did you think this? Why did you think something else? If you're pointing across the room to somebody else. And so it just, it really helped open up, especially for those quieter folks, thinking, okay, is policy matching our expectations? Is the data matching our expectations?
Hmm.
And if it's a policy thing, then obviously policy can be readdressed. But if policy is in place, but the data is not matching our expectations, what could be influencing that? So just continuing to ask those questions and going through slowly. I mean, sometimes we explain a visual 2 or 3 times before we move on, allowing people that safe space to ask the question, say, okay, I'm really not getting this, or you know what would help me more, um, is great. I think that flexibility and openness has been absolutely critical to West Virginia's culture, and I do find it wonderful. It really does just bring a huge smile to my face that some of our folks that had maybe we're holding back the most as far as their uncertainty about being able to use the information or use a CQI approach because of their concerns with understanding the data, are some of the people that ask for data now, the most, and in new ways because they really want to understand and get to their whys. So really appreciative of that. And it takes a while sometimes, but if you trust the process and you keep trying to meet people where they are, there's really a lot of ground that you can move together on it. So I'm very pleased with that.
Mm. And, troubleshooting those common barriers. I like how you said, it could be easier to start with more basic or general questions, meet them where they are. And, every time in my experience, every time there's a new team member involved, right, you kind of want to form that group again. Not set the baseline, but start on simpler terms to make sure everybody's on the same page and can work together. And then you get full buy-in. And I feel that communicating early and often, like you said, and having that transparency will really lead towards better accountability too. What's your
Yeah.
opinion on that? Would you agree with that?
Yeah, I definitely would. And I think one of the things that really helped in West Virginia was we also set our smaller groups to where we met with smaller teams, so that they, sometimes, often, of course, people who may be in with their higher levels of leadership may feel uncomfortable asking questions. So giving folks opportunity to explore in both areas can be really helpful, and also encouraging leadership to ask what might be deemed as a dumb question, but them taking the lead on that. And again, no dumb questions. So I don't exactly like that I used that term, but it's not a dumb question. It's asking the questions that you need to ask to understand the information is so crucial. But again, I mean, for different people, that environment might be different. It might be a smaller group. It might be internal to their team, and just giving them the opportunity to really slow down, digest, and talk about what it means to them, I think is really critical to advancing this work.
That's great. That's great. Well, I want to talk a little bit about we're sort of nearing the end of this second episode here of our lessons learned in CQI with the state of West Virginia. So, Laura, well, I don't want to stop you if you have any more thoughts on the buy-in and troubleshooting that. And if you don't, can we talk a little bit about a couple resources we have, starting with that West Virginia Kids Thrive Collaborative website?
Yeah, so I do have one more thing with the tips, but it actually flows right into resources. Uh,
Perfect.
I just want to add that never underestimate your people resources and expertise. So making sure that you have the right people at the table to have the conversations and understand the data as well as the policy and process and programmatic perspectives. That can be really crucial, and even getting buy-in from families and providers as far as their perspectives of what's happening. And again, understanding that context, like it's always important to look at the context of your data, and for instance, timelines of when things were implemented or something that may have been happening in the world. I think a perfect example of this is the COVID-19 pandemic. It would be difficult to compare, for example, data from 2020 or 2021 to now because of the huge impact that it had on utilization. So, and even things that aren't as big as that can be really significant. So it's always good to have folks at the table and to try to understand anomalies or differences in the data that may really be influencing exactly why the trends are falling the way that they are.
That's great. That's great. The people resources, that could be a third episode, perhaps, talking about those resources. Okay, so I wanted to make sure to capture this great resource that the state of West Virginia has, which is what I just mentioned, the Kids Thrive Collaborative website, which is available at kidsthrive.wv.gov. I know it has resource rundown, but Laura, do you want to talk a little bit about or just mention some of those reports that are on there that are really crucial for the CQI process and making change for West Virginia?
Yes, absolutely. I've talked a lot today about internal review processes or processes that we have with our partners. But another thing that's really important is the publication or sharing our information publicly. And so we do have our semi-annual reports located on the Kids Thrive website. We also have reports and evaluations from our companion partners. And we have a lot of other resources as well. If you go on the Kids Thrive website and scroll to the bottom of the page, you'll see we have some of our key indicators at the bottom that it kind of gives a pulse of where we are. But those semi-annual reports, they do contain a lot of detailed information about our different programs and where we are with outcomes and all of those things. And we do have a How Do I tab, which can direct you to our child welfare dashboard, as well as some additional information to connect with behavioral health resources. We really advocate for our Help for West Virginia line, which has our Children's Crisis and Referral line. Families can call that. And at any point, crisis or not, and connect with information about services that may be helpful for their family. So a lot of good resources on there, as well as supports for those who may need help with basic needs as well. So really encourage you to check it out.
Yes, that's wonderful. I mean, it's such a great website, web pages, and it's great examples of what other states can do, where they can get started, or just how they want to go about demonstrating and exemplifying their data and how they're making change in West Virginia. I also want to suggest a BerryDunn webpage. If we go to berrydunn.com/insights and then click on success stories, there's a success story about West Virginia on there. It starts with the state implements data practices, but that's berrydunn.com/insights. And then you click on success stories. So the Kids Thrive at wv.gov and the BerryDunn websites are great. And, just final thoughts here today, Laura. I just want to thank you again. But if you could give one piece of advice for leaders out there diving into this work, what might it be?
Yeah, sure. So I believe I mentioned it earlier, but I just think it's so important for not only the leaders and the folks that are producing the information that will be reviewed for continuous quality improvement, but also colleagues and collaborators to identify their why and the true meaning and why they're reviewing the data. For West Virginia, again, our shared goal is to help families and youth thrive in their homes and communities, and that continues to drive us into further problem solving and understanding the information that can get us to that goal.
That's great, Laura. Thank you so much for joining us today on this very important topic. We just want to look forward to talking with you some more if the future presents itself, the opportunities in the future. And thank you again, Laura. So, everybody, this is Laura Hunt with the State of West Virginia's Office of Quality Assurance for Children's Programs. And thank you.
Thanks, Amy. Thanks, everybody.